to hear from Dr. Steve Osofsky, and he's going to be speaking. His title of his talk is Beyond Fences, Policy Options for Wildlife, Livelihoods, and Transboundary Animal Disease Management in Southern Africa. Stephen Osofsky is a veterinarian who works on developing and helping to apply science-based landscape scale approaches to conservation, particularly in terms of policy guidance to address challenges at the interface of wildlife, agriculture, and other types of land use and people. He is the J. Hyman Professor of Wildlife Health and Health Policy at Cornell University's College of Veterinary Medicine, and he's one of the pioneers of the One Health movement. He's been involved in many of the big initiatives related to One Health. They are in the package, so I'm just going to say them: the Manhattan Principles of One World, One Health, AHEAD, and a number of others. So I'm going to leave those and just share the rest of this. He has brought his practical expertise, which includes both health and environmental conservation perspectives, to begin to shape an interdisciplinary approach to the field of planetary health. And Professor Osofsky previously held senior positions at the World Wildlife Fund and at the Wildlife Conservation Society, WCS, as well as the government, as with the government of Botswana. He was also honored to serve as an American Association for the Advancement of Science and Diplomacy Fellow, and as a biodiversity program specialist at the U.S. Agency for International Development. And he is now shepherding Cornell University's new Cornell Wildlife Health Center.
Thank you. Well, thank you so much for allowing me to share some work with you here today. Again, my talk is called Beyond Fences, Policy Options for Wildlife, Livelihoods, and Transboundary Animal Disease Management in Southern Africa, all work carried out under the AHEAD program, which stands for Animal and Human Health for the Environment Development, which is under our Cornell Wildlife Health Center umbrella. So this is a zebra dead along a foot and mouth disease control fence in Botswana. And this was something I would intermittently see when I first got to Botswana in the early 1990s to serve as the government's first wildlife veterinary officer for the Botswana Department of Wildlife and National Parks. But the story I need to share with you here today goes back to the late 1950s, when all the countries we're going to talk about were colonies or protectorates. So Botswana was the British protectorate of Bechuanaland. Zimbabwe was British Southern Rhodesia. Namibia was German Southwest Africa, and then under South African auspices. And in the late 1950s, if the colonial powers were obviously looking for economic traction. This is before diamonds were discovered in this part of the world. And if you're a colonialist, that's what you do. And what they decided they would try was to export beef from Southern Africa back to Europe, back to the motherland. But even in the late 1950s, they were aware that the foot and mouth disease family of viruses were resident in the region, in the African buffalo. The African buffalo is the only wild species we know of that is a natural reservoir of these viruses. They don't get sick from them, but they do carry them. So what largely the British and the Germans decided to do in order to export this beef was to start to build fences to keep buffalo and other wildlife over here and livestock over here. And over the ensuing decades, thousands and thousands of kilometers of these fences have been built. Many of them funded externally, not just by the British and the Germans, but by the EU more broadly, the World Bank. And I think it's safe to say in retrospect, what we have can be described as a slow motion environmental train wreck, because hundreds of thousands, if not millions of wild animals like this zebra have died along these fences because these animals need to migrate. I want you to keep this in mind. Migration is the lifeblood of the conservation of these species. They need to migrate to access grazing at different times of year, fresh water, mineral resources, breeding opportunities to maintain long-term genetic viability. So again, this was a monosectoral decision focused on beef agriculture. Wildlife was not considered a particularly valuable resource. So I just want to give you a sense of what these fences look like. The line map is just the major fences in this part of the world. And imagine if you're a wildebeest, you're not going to be able to go across this region. The animals don't care about national boundaries. They historically had these long migratory routes. The color image is an aerial photo. You can see the maintenance roads along a double cordon fence that goes on and on and on into the horizon. This is a well-maintained double corded fence. They're usually 10 to 12 feet high. And if they are well-maintained, they do what they were intended to do, which is to stop the movements of animals. So when I talk to our students, I kind of explain that history as sort of the environmental factors, but I want to spend the rest of our time together really talking about good news. And today, nature-based tourism, nature-based related activities contribute more to the GDP, to the gross domestic product of the Southern African Development Community, the Southern Africa region, than livestock agriculture, forestry, and fisheries combined. That's a dramatic change in the macroeconomic picture, and one that has not been lost upon the heads of states of these countries. So there's been an experiment underway for now about 20 years where more than a dozen peace parks or trans-frontier conservation areas on this slide, you'll hear me say TFCA, trans-frontier conservation areas, are being created. And I want to define those for you. A peace park or a TFCA, trans-frontier conservation areas, when two or more countries essentially agree to rezone, if you will, so that, say, wildlife in a national park in country A can get back and forth to a game reserve in country B. It's a rezoning to facilitate restoration of these critical wildlife movements. And as I said, there are more than a dozen of these now. And if you add up all those blotches on that I put on the map there, it's the surface area adds up to the same as if you had the state of Texas, the state of California, and the state of New York combined. This is, I believe, the largest experiment in terrestrial conservation in the world. And very few people are even aware that it's underway. And I want to be clear, the motivator here is largely economic, and that's fine. If you think about global beef flows, Africa contributes probably less than 1% of all internationally traded beef, but Africa owns nature-based tourism in many ways. It's their global competitive advantage. And so, in many ways, the Peace Parks movement is about making wildlife two things: economically rational and socioculturally acceptable. If we can do those two things, then conservation becomes an ongoing land use of preference. So I want to now quickly zone in on the Kavango Zambezi Transfrontier Conservation. It's that amoeba-looking thing down there. It is superimposed there. You can see on the northeastern United States, it is the biggest transfrontier conservation area terrestrial in the world. And if you think about what it really is, it is not a giant national park. None of these transfrontier conservation areas are parks per se. They're multi-use areas. There's agriculture, there are people, there are railroads, there's mining. But at the core is this attempt to restore habitat so that wildlife can migrate, even though there are other obstacles. So I want to tell you a little bit more about the Kavango Zambezi because it is the focus of our work right now. It was created in 2011 at a heads of state treaty level. Angola, Botswana, Namibia, Zambia, and Zimbabwe came together to create this entity. It's more than 500,000 square kilometers. It's home to about 2.5 million people, which is fairly sparsely populated, which works in its favor, and their livestock. One of the really important things about CASA, I will call it CASA for short, it is home to the majority of what's left of Africa's elephants. Decades and decades ago, we had millions of elephants in Africa. We're down, unfortunately, to less than 500,000. In all likelihood, 228,000 of them. The survey just came out a few months ago. That bulk of those elephants are in these 5 countries. There are significant pressures on this landscape related to human settlement and poaching, drought, and fire. But veterinary fences are at the core of the land use conundrum. And I want to sort of pause for a moment and just recognize that we as a species are very good at seeing snapshots, but we're not very good at seeing movies. What I mean by that is if you go on safari today to Botswana or Namibia, it's spectacular. You will see spectacular wildlife. But if you saw those same landscapes in the 1950s, there were far, far more many wildlife across this habitat. All the major wildlife species have declined because of these threats, including fragmentation of habitat, the building of fences. The other thing I should mention, we've heard a lot about climate change today. If you think about the climate models and what they say about Southern Africa, it all points to an ongoing drying trend. And the only way for wildlife, or in fact pastoralists and their cattle, to be able to adapt to climate change is to be able to move north-south adaptively. But the fences even preclude the only major adaptive strategy available to both wildlife and people. And the premise of the work we're doing is that the way we've chosen to manage diseases like foot and mouth with geographic barriers threatens the entire vision for a successful transfrontier conservation area. I also want to be clear that cattle are part and parcel of the cultures of these countries. Botswana has had cattle since 600 AD. This isn't about pitting one sector against another. It's not either or. It's about finding a resilient combination. We learned very harshly during COVID when tourism completely dried up. It was a good thing people still had their livestock. Similarly, when you have droughts, livestock often get hit hard first, but tourism can go on for quite a while, even in the face of drought. So we want resilience. We want to find a way to harmonize these sectors. So I just want to recap some of the things that I've explained. Transfrontier conservation, this whole movement requires the free movement of wildlife over these large geographic areas. And yet, the historically accepted approaches to the management of transboundary animal diseases requires the prevention of movement of animals. So the vision for peace parks and a geographic or fence-based management of animal diseases are fundamentally incompatible. And sustainable livelihoods depend on a new approach. If you look at what's happened with foot and mouth disease in the region, I've got 3 countries here, Botswana, Namibia, and South Africa. And each of the 3 bars are a decade of the incidence of foot and mouth disease outbreaks. And you can see up until the 80s and 90s, we had a lot of foot and mouth, and then vaccines were introduced locally. And we had a precipitous drop in the incidence of foot and mouth disease outbreaks. That was great. It was great for livestock agriculture, but you can see it didn't take too long for the outbreaks to be rebounding. And that's happened for a few reasons. First of all of that fencing infrastructure that I mentioned to you, it's really expensive to maintain in a place where elephants constantly break it. And a lot of those external subsidies that I mentioned have melted away. We also have the same problems managing foot and mouth that we've seen with coronavirus, with COVID, where vaccines have to keep up with the circulating strains. And that's a challenge. And sometimes there might be mismatches between the vaccine strain for livestock and what's circulating. And even getting enough vaccines into enough cattle to make an epidemiological difference becomes a challenge as more and more governments are strapped in terms of their veterinary services. So we've had more than 30 outbreaks in this decade. That I need to update that number. And what we really have now is a crisis. You can see foot and mouth outbreaks are constant in the region, but for what we're trying to do, this crisis does represent an opportunity. So this is that same amoeba I was showing you before. You can see the green outline is the outline of the Kaza Transfrontier Conservation Area. What I want you to notice here, does my pointer show up on there? Yeah, it does. All these 6 circles with lines in them, those are the 6 most important corridors for wildlife to be able to migrate. This has been found through radio telemetry work, long-term wildlife observations, historical records. We know where the wildlife need to be able to move, and all 6 of those are either currently compromised or will likely be compromised by things like veterinary fencing. So we're going to zoom in here. This is the Okavango here, and we're going to zoom in. And in this map, we've zoomed in. Here is the Okavango River. Here's the Okavango Delta. Many of you have heard of it. In this map, the fences are yellow and black. There's foot and mouth disease fences. There's also fences for what's called bovine lung disease. And I want you to focus on this pocket here. I think by nobody's design, the fencing system created a giant pocket, and elephants live in this pocket. There are about 18,000 elephants and about 15,000 people. And along the river, there are a lot of human habitations where the elephants don't really want to get into trouble. So what we've got is a giant cage. And this elephant population is growing at least 5% a year. This is the hotbed of human-elephant conflict in Kaza. Elephants raid crops, people get killed. This is a pressure cooker. And it was created inadvertently by a fencing policy that didn't take the ecosystem into account. So now we've got to figure out what to do about this. I want to put a finer point on it. This is some fascinating data from Robin Naidu and team from Frontiers in Conservation Science. This is based on years and years of radio telemetry. The top map, you can see this black area. That's that same pocket. Those are dots representing satellite collar readings from female elephants that were collared in Botswana. And over the years, you can see they never left that box. The red in that map are female elephants collared in Namibia. And they're also bunched up along the other fences that I showed you. The female elephants are not able to get through these barriers. I'm going to tell you why. But interestingly, this map down the bottom is a little bit different. Male elephants. The male elephants collared in both countries, it's a little bit more of a diffuse picture because the bull elephants don't stay with the herds. They will break through fences and move around a bit more. But the herds, the females don't move because even when the fences are badly damaged, there's a cable just about this high, just at elephant calf height. And if the elephant calves can't cross it, the herds won't cross it. So those elephants are boxed in. This is a fairly decrepit fence, and I'm holding the cable just to show you that this one piece of infrastructure has this huge impact. This is data shared by the government of Botswana, the government of Namibia, the NGO EcoExist, and the World Wildlife Fund. And this is real, again, radio telemetry data, and I want you to focus in that same box, those gray elephants, those are females bouncing around like ping pong balls, hitting that fence. The red on the Namibian side, same thing. Female elephants largely bouncing along another fence. They just can't get through. And it's not just elephants. Elephants are a very visual species for us to use, but we've documented a whole range of species with this same problem. So I'm trying to make it clear that in this part of the world, livestock agriculture and wildlife conservation are both absolutely vital for economic development, for resilience, for equity. And I've mentioned that people need their livestock, but that nature-based tourism is crucial to economic growth. And what we've seen over the years is that the current attempts to control foot and mouth geographically, meaning with fences, is now limiting livelihood opportunities, and it's compromising the whole system. And we have this intensifying conflict between these two sectors. The livestock sector blames wildlife for the presence of this foot and mouth disease virus, and the wildlife sector blames livestock for the fences. So we need some solutions. And that's what we've been working on for a number of years. And whatever we come up with has to do fundamentally three things. It has to help Southern Africa's pastoralists and farmers. The solution can no longer threaten the future of free-ranging wildlife. And we've got to be able to provide confidence to any countries that do want to buy beef from this part of the world that they're going to be able to import a product that's safe. Remember, the whole European model here, they didn't want to accidentally have foot and mouth get into their cattle and then import it to Europe, because that's a disaster for your livestock. It also shuts down your international trade overnight. So the whole world is afraid of these viruses. So we've got to make sure whatever we do is safe. So if we can add an extra hour, I have a whole lecture on the solution that I'm going to summarize in one slide. The solution is remarkably simple. There was existing science to show that if you want to make a high quality steak, your cattle are going to be vaccinated, you're going to quarantine them. But when you slaughter them, if you hang the beef above 2 degrees Celsius for 24 hours so the pH drops below 6, then you debone it and you take out the lymph nodes, that beef is going to be safe in terms of FMD. FMD, if that cow had the virus in its system, that virus would not be present in the end product. That value chain-based approach, we didn't invent it, but what we did is work with our colleagues in SADC and the African Union to convince the World Organization for Animal Health, OIE, now WOA, that this biosafety-based approach, this value chain-based approach should be considered equivalent to fences. It took about 10 years using science-based advocacy to convince OIE to change the rules. But in 2015, all the world's chief veterinary officers voted on changing what's called the Terrestrial Animal Health Code. These rules are what the World Trade Organization relies on for countries, and all the world's countries are members of the OIE. It's older than the UN. These rules are what allow for the safe trade of animals and animal products around the world. So in 2015, this approach where we looked at how beef was produced was accepted globally. And that was a huge transformation in thinking. And that meant that the poorest farmers living in northern Botswana, closest to buffalo for the first time in 70 years, that's multiple generations, could access international markets for their beef. So the science is there, the policy's been changed, and now we're working to implement this in partnership with the countries that want to pursue it. And one of the things we did with the SADC, we wrote the guidelines how to do this. It's a very simple, this is not a complicated exercise, but how to process that beef from farm to fork to make it safe. It's really low tech, but it's very well documented. And SADC has now made this an official document. SADC, the Southern African Development Community, is essentially, it's like the EU of Europe. It's the official body that governs the countries on these things, from Tanzania to all the way to South Africa as a multilateral organization. They've now adopted these guidelines for what we've called commodity-based trade of beef, because we're focusing on the commodity, not whether the cow happened to be living near a species like an African buffalo. Now that those guidelines have been accepted, we're working with individual countries. Here's an example from Botswana where they asked us to do what's called the gap analysis. They said, look, let's look at our value chain, again, from farm to fork. What are we doing well? What can we do better? Looking at everything from vaccines to quarantine to slaughter facilities to how the animals are herded to keep them away from wildlife, all the risk mitigation that's needed. And the government of Botswana has now been using this gap analysis, again, to implement this process so that the poorest of poor farmers for the first time in generations can trade their beef. This enabling environment that this partnership has created gave the partner countries the confidence to work with us on what was really a thorny question. Remember, I told you we knew where the wildlife migrations were most damaged by fences? Well, this was an analysis we did during the pandemic that really put a fine point on this. We went fence by fence. We did aerial surveys and ground surveys and looked at tracks, spore surveys, historical data, radio telemetry, and we showed exactly which fences are damaging which species most significantly. When I first started in Botswana in the early 1990s, that was not a question you were even allowed to ask. But because we've been working to solve these problems, there's now a willingness to revisit a paradigm that needs some rethinking. So I want to share with you the very basic results here. This is that same amoeba map, but I've inserted Botswana's map with the fences shown. The red fences in this map are fences that are going to stay pretty much regardless. They're important. They need to be there for managing the beef sector to allow the ongoing exports of beef. But the two different shades of blue are the fences that we found are most damaging to wildlife movements. The dark blue fences, on one side or the other, there's significant livestock populations, so some more work would need to be done to even talk about whether they could be removed. But the light blue fences, the aquamarine fences, pretty much cover almost all of those 6 key pinch points that I described to you. And these are the light blue areas that are most damaging to wildlife. And with the advent of new approaches to herd management and commodity-based trade of beef, this way to be able to sell your beef without requiring fences, that's the key. The OIE says you don't need fences if you do this right. The governments that we're working with in CASA have now given us the green light to answer the question, what if some of these fences were no longer there? Some of these fences were put up decades ago. The epidemiological situation in many cases may have changed, and we have this new tool, this commodity-based trade of beef. So we are now finishing up an analysis, basically asking a scenarios-based question. If this 50 kilometers of a fence wasn't here, would it cause more risk to your livestock or not? If not, would you consider realigning it to restore the migrations that are the lifeblood of the biodiversity of the region? So I was just last month around the UN General Assembly meetings talking about this with President Masisi of Botswana and Minister of Environment Kareng. This is a really important discussion. And Botswana is a small country. We've been working directly with their version of USDA veterinary services, with their departments of veterinary services in Botswana and Namibia. But I also wanted to make sure that we had support at the highest levels of government. And frankly, the issue of that human-elephant conflict, that pressure cooker that I mentioned to you, was very much on the president's mind. So I'm cautiously optimistic that we're going to be able to continue to navigate this to find a win-win solution. I'm off to the region again in 2 weeks, where we're presenting the epidemiological analysis that I've described to you, where we're going to go fence by fence and offer up, using data that the governments have provided, say, look, this fence, you're right, it needs to stay, because if you take it down, you're going to get more foot and mouth or more lung disease in your livestock. But this fence, if you take it down, we don't believe it's going to pose any increased risk for animal diseases. That's what we're going to be doing in November. All this work was done under the auspices, again, of our AHEAD program, Animal and Human Health for the Environment and Development. We're basically a facilitator. My role is to be a biodiplomat and to bring these sectors together using good science, but to recognize that we can find harmonious ways to solve these sectoral challenges. I've got 20 years of data and reports at cornell-ahead.org. And our broader program is well summarized at wildlife.cornell.edu. And I think that's all I have. Thank you.
It's superb, fascinating. I know there are many questions, but I think we're going to move on to our final speaker, and then we'll have a little stretch, and then we can dive in with our discussion.